As promised, here's a few slides on thyroid. So it is very confusing to people because low thyroid is usually diagnosed by a blood test that comes in high. That's very counterintuitive because normally if we measure the actual thyroid hormone, now when we measure thyroid hormone, T3 is the actual hormone that's the effective hormone. But because it's so changeable, we usually measure the T4. And to be most accurate, we even measure the free T4. In low thyroid, that might be low, but it also might still be normal because the thyroid gland may be overworking to produce a normal amount. In that case, we can see that the TSH, the thyroid stimulating hormone, will go up. So the normal TSH is about 0.5 to 4.5 or 0.5 to 5, depending on the lab. And so if you start getting it up in the 6, 7, 8, 9, 10 range, that means that the patient is not producing enough thyroid, and the brain is telling it, you need to produce more, and thus is raising those TSH levels. So if someone has a TSH level of 10 or so and they're having symptoms, we start them on some T4, some Synthroid. The body then converts that from T4 to T3. Levothyroxine is the generic name for that. In the old days, we used to think that brand name was medically necessary. We've kind of moved away from that because we feel like the generics are pretty accurate. But because it's a medication that we're really trying to hit a sweet spot, most people try to get the TSH between 1 and 2, then we really do need to have a consistent medication. So usually what we'll do is we'll start them on some medicine, we'll recheck that TSH in 6 weeks, and then we'll adjust the thyroid hormone based on that. Now, some people will measure T3. The problem with that is that a lot of people, if they are really sick, especially in the ICU or somewhere where they're under a lot of stress, the T3 level will go down, even though the T4, the TSH, all of the other numbers are normal. We call that euthyroid 6 syndrome. It's one of the many reasons that we don't usually measure the T3. But there's other people that feel like, hey, if the T3 is low, that's an issue. There's something going on there. The folks that are worried about T3, and especially if the T3 level is consistently low, there are 2 medicines that you can use that will raise that T3 level. One of which is Cytomel, which is actually a synthetic T3. A lot of the people that see that prescribed feel like more of the benefit is because people believe it's going to make them better, more so than it actually makes them better. But no matter what, some people really do seem to feel better on that T3 supplement. Usually the ratio is about 1 to 12, so they'll be on the levothyroxine as well, but we'll add a little bit of Cytomel as well. Now, Armour thyroid is the old-fashioned thyroid. It's basically when you take pig's thyroid glands, you crush them up, and there will be a combination of T3 and T4 in that. And so when that medicine is administered, then patients are getting both T3 and T4. We still just measure the TSH. We can measure the free T3 and the free T4 levels as well. But generally, we measure the TSH. Now, some people use thyroid in an effort to cause weight loss. In people that have a normal thyroid, if you give them more thyroid, they won't usually lose any weight. They'll usually just excrete that. If you have somebody that has low thyroid, they may in fact gain a little bit of weight when you put them back onto a normal thyroid. Or they may lose weight. It really depends on what the processes are that are going on. It is something that you need to keep in mind because a lot of patients will go to providers that give them thyroid, and sometimes we actually get low TSHs because those patients are clinically hyperthyroid. So hyperthyroid is a condition in which the thyroid is overactive. Now, one of the concerns is that cancers can cause hyperthyroidism, and so patients with hyperthyroidism need to have a workup to rule that out. It also can be an autoimmune process where the body is attacking its own thyroid gland. Um, Autoimmune can be either low thyroid, and that's called Hashimoto's thyroiditis, or Graves' disease, which is hyperthyroidism associated with an autoimmune process. Treatment for hyperthyroidism, we can actually block the effect by using beta blockers. So most people that are hyperthyroid are tachycardic, their blood pressure is high, they're nervous, they're anxious. Usually we'll use a non-selective beta blocker like propranolol as opposed to a selective beta blocker like metoprolol or atenolol. Metoprolol and atenolol are going to work on the heart, but they're not going to get rid of those other feelings such as the nervousness. We can also actually use a medication which directly blocks the thyroid hormone, and that's propylthiouracil, PTU, or methimazole. And those medications both work very effectively to block the thyroid. The problem is that usually when somebody's hyperthyroid, their thyroid kind of goes on and off. So very frequently those people will need surgery to remove a portion or all of their thyroid gland, but that kind of goes beyond the pharmacologic treatment. So stay tuned and you'll learn about that later on in your program.